You're watching News 10 ABC's Hospital Town Hall, COVID-19 in the Capital Region.
And welcome back to our Hospital Town Hall, reflecting on the pandemic, lessons that we've learned, and what to expect down the line.
We've been dealing with this for the better part of 2 years now. The first reported case in New York coming in March 2020. Then 2 days later, 2 cases in Saratoga County. Within 2 weeks, it hit Albany County.
And since then, we've gone to masking, vaccinations, and now the booster shots are being given out. Even some oral pills receiving FDA authorization recently. Let's talk about now what we've learned so far in terms of treatment for the virus. Kicking it off with Dr. Delfino from St. Peter's. Your group has been working with monoclonal antibodies since the early days of this pandemic. So now, has that developed into a specific treatment?
That's a great question. Yes, we were some of the first to be using monoclonal antibody, and I really want to give credit to Dr. Melissa Fiorini. She is an emergency department physician who stood up what really began as a pop-up clinic to give this new treatment, this monoclonal antibody, and has really grown into quite the center for the most up-to-date medications for treating COVID-19. We are one of the leaders in New York State, and even as of a couple weeks ago, we're administering up to 300 doses of monoclonal antibody a week. We also, in addition to having monoclonal antibody that's specific to treating Omicron, are administering a medication that was mentioned before called remdesivir. It's an IV medication that we've been giving in the hospital and was recently approved for outpatient therapy. So if patients who are at very high risk of hospitalization or having severe illness with COVID-19 present to their doctors early enough, this is a medication that we can now infuse to patients over the span of 3 days as an outpatient in the clinic that can reduce their risk of hospitalization and death by up to 80%. We also, in our infusion center, are now offering a medication called Evusheld as well. And that's for patients who are either unable to be vaccinated. So these are patients who do not have COVID-19, but who are either for one reason or another unable to be vaccinated or are moderately or severely immunocompromised and just don't mount the immune response that they should when they receive the vaccine. So this monoclonal antibody is available to those patients so that they will have protection if they are exposed to COVID. And again, it will reduce the severity of illness that they would have. So a lot of great treatments.
Dr. Delfino, thank you so much for addressing all of those different treatment routes. We had some viewers bring up treatments that have been making headlines, like the hydroxychloroquine and ivermectin. Dr. McKenna, this question is for you. From DJ Miles, he writes, the quote, why have health officials across the country denied proven antiviral drugs for use as a prophylaxis and to treat infected people in the early stages of infection to cure them? That question from DJ Miles. Dr. McKenna.
Sure, I'm happy to answer that. Going back to Dr. Delfino, I agree that the monoclonals are fantastic. I agree that Dr. Fiorini is great. At Albany Med, we also have 2 emergency physicians here, Potenza and Dr. Wu, who do the same thing. So proving if you have a problem, throw an emergency physician at it, and they're going to help you solve that problem. But as to the question from the viewer, I would say this. There are drugs which are FDA approved, and those drugs sometimes are used in what we call an off-label use, and that is something that does happen in medicine. And there has certainly been talk about hydroxychloroquine or ivermectin as a medication which could be used. I believe in the FDA approval process, and I believe that in order for me as a physician to prescribe a drug, I want to be sure it's going through the highest level of approval process. And the process of either the vaccine approval through the emergency use authorization process or the approval of drugs to treat COVID is one that is very rigid, and it's one that I support. And the fact of the matter is rather than focusing on drugs that have not been approved, I would draw our attention back to the ones that have been, including the monoclonal antibodies and the remdesivir and the FDA-approved oral pills for COVID that are really making a difference. And if somebody chooses to use something off label, I would remind them that there are other things that are being used that we have seen absolutely making a difference as far as recovery time and survival with COVID.
Dr. McKenna, thank you for that. We're going to switch gears now back to resources. At the start of the pandemic, there was a huge strain for personal protective equipment. People were volunteering to make face shields and even masks.
That's right. And then even donating them to the hospitals and healthcare workers who didn't have enough. This was early on in the pandemic. You all remember it. Testing now has become widely available since the early days as well.
And Dr. Mastriani from Saratoga Hospital, are there any items where you are in short supply, and what could be the next shortfall in resources as you look ahead?
Well, you're right. This resource issue has come along through the pandemic. We've had tremendous creativity seen across the healthcare system. Our own contribution was to put 3 to 5 swabs in a tube and run pool testing. And so we were able to do that to conserve resources. We got some wonderful donations of some face masks from our local industry at the start. I think the next thing that we're facing in the next few months is blood. And Dr. Delfino mentioned that. This is a critical shortage, and it's a shortage that people listening can help with. You can help by donating blood with the Red Cross. The Red Cross is really critical, and this blood supply is really critical. As a hematologist, oncologist, I see that because we're restricting blood transfusions to people who would otherwise get them to improve the quality of their life, so they can walk around and do more with chronic cancers or blood disorders. And we've had to tell them, you can't do that right now. The quality of your life won't be quite as good because we need to save the blood to save somebody else's life. It's a very hard thing to say. It's a very hard thing to hear. The nurses in our transfusion unit are struggling with that, and it's something that I think is facing us right now. The other shortage that we have is the shortage of human beings. So we need more people in healthcare right now, and we need them in all areas of healthcare, from nurses to people who are willing to do transport, to people who clean the rooms, to public safety officers, everywhere. And if you're a young person right now and you're not sure what you want to do, think about us, give us a try. Healthcare is in a remarkable place to be right now, and your life will have meaning. I can guarantee you that, and you'll see amazing things.
A lot of people reconsidering career options right now during the pandemic, so certainly an outlet there.
Right.
Thank you, Doctor. Want to shift here to Dr. Mayer and a slightly different take, Doctor, on the staffing issue here. This regards healthcare workers who had to leave after refusing to get the vaccine. And this question from Bobby Halat. How do the experts explain how so many medical professionals do not believe in the vaccine? It seems to me that when medical professionals do not get vaccinated, it just feeds into the misinformation that so many people are believing. Dr. Mayer, your response to that?
Yes, thank you. It's a good question. Without a doubt, this has been a very difficult and stressful time for the healthcare system and certainly healthcare workers. And, I started my career in medicine over 40 years ago now. So I'm a primary care physician. So I spent a lot of time in my career not only helping people sick, but also preventing illness. And to me, when this vaccine came out, it was like kind of a no-brainer. Of course, we're going to get vaccines. And as Dr. Goldberg was alluded to his career and seeing some of the things we've done in the past number of years, that vaccination is really one of the main ways we prevent illness. So, yes, it's difficult to understand, and there's certainly we have to respect people's free will and how they respond to this, and there's been no shortage of discussion about this in many different realms. But we want to encourage vaccination. We know that this is helpful. Certainly, there's folks who've had vaccination and have had reactions to it, but by far and away, the people who've gotten vaccinated have had very few side effects, apart from a sore arm, which seems to go hand in hand with most vaccines. But the fact is that we want to encourage those folks to get it. We believe in it as healthcare workers, and we feel it's safe and also effective. In terms of healthcare workers leaving and or other people leaving, that's a discussion we have with each individuals in our system and all over across the healthcare systems in our region about trying to educate people as best we can and helping them understand the benefits of it. We do see people leave, and yet we communicate that they're always welcome to come back, and with open arms to help us in this great fight. And as mentioned, this is a rewarding field. I mean, it really is. There's very few occupations out there that you have the sense of helping others, and having that privilege of doing that for your career is really hard to put a value on.
Certainly, Dr. Mayer, thank you so much. Now, we've been gathering viewer questions through email and social media, and we want to dig into some more of those specific inquiries now.
Yeah, and doctors, we're going to hop around a bit. Feel free to jump in wherever you see fit.
The first question here from Nikki Harrington, and you can see it on the screen. Our viewers can. Why are we mandating vaccines, she asked, for healthcare workers when, according to the studies, people that are fully vaccinated and boosted are still able to catch and pass the virus around? Dr. Sir Filippi, we will give this question to you. Your answer.
That is a great question. And it is true that you can be vaccinated and even boosted, and you can still come down with the virus, especially Omicron. It has ways to get around how some of the vaccines work. But the vaccines are still proven very effective, in part because there's two sides of our immune system, or two parts of our immune system. There's the antibody response to the vaccines, and then there's a cellular response to the vaccines that provides some memory to fight infection if it gets along too far. So yes, you can still come down with infection, but I see it every day, and I see patients who are unvaccinated are by and far the population that I see in the intensive care unit. I do see occasional vaccinated patients in the ICU, but most of those patients have significant underlying conditions. So vaccines help decrease hospitalizations in the overburdened hospital systems. They decrease the severity of illness. They help prevent spreading infections to those who are more vulnerable. So they're still very effective, and one of the primary tools that we have to help stop this terrible disease.
Thank you, Doctor. Let's take a look right now at CDC guidance as it pertains to staffing. This comes from one of our viewers, Jamie. He says, given that the current CDC guidance allows for people to return to work just a few days after testing positive for COVID, what precautions do hospitals take to protect their patients from contracting the virus from recently infected frontline staff? Dr. Goldberg, I'd like you to take that one. What are your thoughts on that and that CDC guideline there?
Well, sure, that's a great question. After 5 days, the contagiousness is markedly diminished, but no one can enter our hospital, like all other hospitals, without putting on a mask. Our staff must wear a surgical mask, and if they're taking care of a patient with COVID, they wear something even more impermeable, like an N95. Our staff wear full PPE when taking care of patients, including eye protection, gowns, gloves, masks. Early on, we saw that in those rare circumstances where healthcare workers got COVID infections, more often than not, they caught it outside the hospital, not in the hospital.
And I would add that the 5 days is the minimum criteria. No one is allowed to return back to work if they have any ongoing symptoms. Some individuals will stay out more than 5 days. And of course, testing is one of the things that we often use with our workforce before we allow them to come back to work as well. And that's true everywhere in the state.
Thank you, Dr. McKenna. And we also have another question for you while you're on. Jamie now asks, who poses more of a COVID risk to someone that they are providing medical treatment to? A fully vaccinated person who tested positive 5 days earlier, or an unvaccinated person who recovered from COVID 60 days earlier, and why? Dr. McKenna.
You know, honestly, that's an interesting question. I'm not so sure. I think the truth of the matter is that the unvaccinated person who recovered is somebody who still potentially could get COVID. I think in either case, what we want is we want our workforce to be vaccinated. All of us proudly work for hospitals where 100% of our workforce is currently vaccinated. We all require that individuals do not work while they're symptomatic, and if they are, they stay home. We obviously require all of our healthcare workers to wear masks and protective equipment. And I think those are the things that we're putting into place. As far as the two scenarios, I'd have to go back and look at that a little bit more. But I think the fact is that the protocols we have in place today ensure that we're providing as safe a care as possible.
Thank you, Dr. McKenna. We have a unique question here from Jessica Best. And she asks, I would like to know, what impact does the vaccine have on people with multiple sclerosis? Dr. Delfino, do you have any insight into that?
That is a very good question. I do not know specifically the impact on those who have multiple sclerosis. I'm not sure if any of the other physicians on the call have any expertise in that area. I would recommend that she speak with her neurologist, who probably has the most up-to-date information and could inform her and others with MS.
Okay. Thank you, Dr. Thank you,
but
Dr.
definitely, oh, go ahead, Dr. Serfilippi.
I
we have a
agree.
hand.
I would add to that patients with multiple sclerosis, and some of them, unfortunately, they're weak. Their swelling may be impaired a bit. They are at risk and higher risk for pneumonia. So in the event that they do become ill with Omicron or any of the coronavirus in general, they are more prone to have a more serious illness.
And I would add too that the patients, we know that the virus has the capacity to affect the central nervous system. So with the symptoms of weakness and paralysis and so forth with multiple sclerosis, that those patients could end up worse if they have is affected into their central nervous system. But I would agree with Dr. Delfino that they need to talk to neurologists, their specialists about that.
Okay.
Good advice there. Yep.
Two similar questions for the doctors here. I had COVID pneumonia and was hospitalized for 5 days in October. Last week, my hair started falling out, and I was told that it was a result from having COVID and it could last for months. Is this true, and is there anything I can do to stop my hair from falling out?
And then there was a follow-up here, similar, since my first hair shampoo, since Delta COVID infection, I have lots of hair loss. This has been since August. Should I take a vitamin, a special shampoo? When will this hair loss stop? Any takers here? Dr. Serfilippi, you had some thoughts on, the potential impact in terms of multiple sclerosis with the vaccine, but any thoughts here in terms of this seems to be potentially a case of long-haul COVID, and there have been some reports of this type of hair loss?
That one, I have no knowledge of hair loss associated with COVID, so I'll have to defer to my colleagues here.
I'll jump in there and say, although I don't have anything specific to say about COVID, we do know that there are certain stressful medical situations. It's a known fact that in certain circumstances, people can get hair loss, alopecia as a result of some traumatic medical event. And by and large, when that happens, that hair can come back. Obviously, in this specific case, I can offer no insight as to how long that will take. But this is a known phenomenon with some people who have a dramatic or significant medical event.
Interesting. Thank you, Dr. McKenna.
This one from Maria on Facebook. Will COVID-19 vaccines be something we will have to get vaccinated with yearly, like the flu vaccine? When will we reach herd immunity? Dr. Serfilippi, do you have an answer for that one?
That's a very good question. I'm impressed by the fact that Omicron was first recognized in South Africa and very quickly spread to the United States and throughout the world. And in part, that's due to the fact that vaccinations in some of the poorer countries are very low. And that population serves as a reservoir for mutations and variants to arise. and they will quickly spread around the world. So I think that COVID or a variant of COVID will be around. I think we'll be better able to respond to it either through changes in our vaccinations or the vaccine itself, and treatments that will be available and are available now and will only get better. But I think we're witnessing this evolution occur before our very eyes in the last 2 years. We've seen variant after variant. I do not think that's going to change until we can actually vaccinate the world. And it's a moving target. And so it becomes very frustrating.
Okay, thank you. And this one from Nikki Harrington, again, she asked a question earlier. Looking at childhood vaccination, she asked, how are we allowed to mandate a drug for children when studies from other countries are showing that the benefits do not outweigh the risks? Dr. Mastriani, we want to have you answer this question.
Well, that's a complicated question in terms of how you look at the data from these studies and then how you interpret it in terms of your approval process. And I would say that for many of us, we think that the vaccination data, as it's been moved forward in this country, has been really done in a very careful and thoughtful way. I certainly feel that way. And so I'm satisfied with the process. It doesn't mean that other people can't look at it in the context of their own countries and their own processes a little bit differently. But I think the vaccination approval process in this country has been thoughtful, it's been deliberate, and I'm very supportive of it. I don't have any fundamental questions about it.
All right, thank you, Dr. Mastriani. We do have a group question for all of you. This one is a very simple question from Donna. It's probably our simplest question yet, but the answer might be pretty difficult. So we want to hear from everyone. She simply asks, how will this virus end, or will it just continue? Dr. Mastriani, let's start with you and then we'll go around in the group.
Well, I certainly don't know. And I think that's the message. I think if anybody really is positive they know, then I think they're probably wrong. So we don't know. But what we do know is that we can be prepared and we can continue to take the lessons that we've learned from the last 2 years and move forward with them. I think to that lesson, we can add that we all need to be patient with each other and we need to take the time necessary to respect each other as we go forward with this. I would also make a plea to please thank your healthcare workers who have been so really so much on the front lines of this. So I don't know when it'll end. I hope soon, but I don't think we know.
Dr. Sir Filippi, your answer.
Well, the first SARS virus, a coronavirus, severe acute respiratory syndrome virus, and the MERS, Middle Eastern Respiratory Syndrome, another coronavirus, sort of stopped in your tracks by real strong local control. And unfortunately, this cat is sort of out of the bag. So I'm hoping that this virus mutates in a way that it becomes certainly less lethal, and that our treatment is going to be much more effective, and we're not going to see patients end up in the ICU. But as far as I can see, I don't have an ending. I don't have an end for this current situation.
We'll continue going clockwise here. Dr. Mayer.
Yes, I mean, obviously nobody been fooled before what we thought was going to happen, and here we are still 2 years into this pandemic. If we look at where we were back in the early 80s with HIV infection, there was a lot of misunderstanding about that. Some of us are around during that time. It was a very scary period of time and so forth. So we're still very early on in this, and it's hard to know where this is going to be. And HIV came out 40 years ago now, and we certainly have good treatments for it, and we're able to control it, but it's still around. And I wouldn't be surprised if COVID's still around in some way, shape, or form, decades from now.
Dr. Goldberg.
Well, if nobody else on the panel knows, I wouldn't live with the answer. But I think we're hopeful that this becomes a a virus that we will continue to immunize people against. These these vaccines are more effective than the influenza vaccine, significantly more effective. And it's interesting that periodically we've had worse flu seasons, milder flu seasons. Last year, we hardly saw any influenza at all. A lot of people attribute that to mask wearing. This year, we were bracing for a more severe flu season, and it really hasn't materialized. It's more than last year, but it really hasn't sustained or approached the pre-pandemic levels. So hopefully vaccines, which are going to be different every year as the virus mutates, and that's why you have to get boosters. As the science progresses, we expect that the boosters may last a year rather than a period of months, like the flu vaccine does, but only time will tell.
Dr. Delfino, I sense a theme here, but we definitely want to get your final thoughts on this as well.
Yeah, I would agree with everything that's been said. It would be great if we had a crystal ball and we knew what the future held for all of this, but we don't. But the one thing that I think we've definitely learned through the past 2 years is how agile we are as a healthcare system, how we can flex and bend to all of the challenges that come at us and how we can collectively work together to solve these problems. I mean, if you really think about it, in under a year, we had a vaccine for this life-threatening medical condition. Now, Dr. Mayer spoke about HIV. We've been working on HIV vaccines for decades. So when you really think about what our pharmaceutical industry has been able to do and what we've been able to do in hospitals, it is absolutely remarkable. So yeah, it would be great if this all just ended tomorrow, but that's likely not going to happen. But I am reassured by what we are able to do and how we are able to face these challenges.
And Dr. McKenna.
Obviously, I agree with everybody. We don't know. I tend to believe that we will probably have to be dealing with COVID for quite some time. In the history of infectious diseases, really, there's very few, if any, other than smallpox, of infectious diseases that have been eradicated from the planet. I suspect COVID will become another type of virus that we deal with, perhaps seasonally. One thing that a lot of us have been saying for a while is it's not about living without COVID, but how we live with COVID. And I think we need to continue to focus on how we get back to children in-person learning in school. I think social isolation has had some challenges and an increase in mental health. I really hope that people will take this opportunity to do the certain things they can do to keep their own personal health up. I'd like to see more emphasis, if we're going to have to deal with COVID, that we take more personal responsibility about our diet and our exercise. We have to lower our blood pressure. We have to exercise more. We have to lose weight. We know those things will help us not only with COVID, but they'll help us with heart disease and stroke and diabetes. So I think it's about figuring out how to go forward and how as a society we can get back to how things were before the pandemic.
Couldn't agree more. A lot of things factor into our health than just COVID. Doctors, it was a pleasure. Thank you for joining us for this hour-long special. We hope our panel helped answer some of those questions.
And we thank our panel. We know that you have such a very busy schedule, so thank you so much for taking the time to be here and helping answer all of these questions from our viewers and providing your expert analysis and your answers to this ongoing pandemic that we know the end is not quite near just yet.
Yeah, we know it hasn't been easy, certainly for our doctors and for the viewers at home. We will continue to get you the answers you seek. Thanks so much for joining us. I'm Solomon Syed.
And I'm Trishna Begum. Have a great night.